Hello, I'm Jackie Rayner. I'm the ward sister on an elective surgical ward at the West Suffolk Hospital. It was Rose Vital Tray that we entered. There you go. So the reason behind this was surveys that we carry out for our patients before they go home. There were many complaints about noise at night. So we looked into what we could do. So first we thought about what's causing the noise, what's the problem. There are various things, observations being carried out on patients every hour, patients chatting, bedpan masher, the printer going off in the middle of the night. So we definitely had to look at this. So there's a picture of our tray that we use. So as you can see, it says, please use me before every meal. And in there we have some hand wipes for patients they can use before a meal. And also, please use me when you sleep. So as we move on, we'll see what we have there. So again, we did the survey, and 85% of the patients' questions said they were disturbed by noise at night. So the impact of that were our patients were too tired for their rehabilitation. Part of our ward is an orthopaedic ward. We have patients undergoing joint replacement who need quite a lot of rehabilitation. Patients were also taking longer to recover, which then led to an extended length of patient stay, which is not good for the patient. So how could we solve the problem? So this is just an example of the questionnaire that we were giving patients at the time. So then I'll hand you over to Rose, who had the marvellous idea of the trays, and she can talk you through how she went about it and how she had this wonderful idea. Over to you. All right?
Thank you very much. Good afternoon, everyone. It's a great opportunity to stand here in front of you and present what we've done. First, I will just tell you how did the rose tray come up. This is based on my own experience in the ward. When I was doing the NVQ at the same time, we have this problem about the noise in the night, and this has been, as my sister said, it's 85% of the patient complaining about the noise at night. So I think of an idea as part of my NVQ. And at that time, my manager in the ward is giving us earplugs to give to the patients. But at that time, it seems that the earplugs is just go everywhere, and they don't know that if they can use it or not. So I come up with the idea to make it more visible to the patient when they arrive to the hospital, that they can use it, as well as the wet wipes. So I come up with the tray, which I go back with the picture of the tray. It says, please use me before every meal. And on there is wet wipes. And please use me when you sleep. And in there is the earplugs. So when they come to the hospital, they will see it. And it makes them more welcome as well. And thinking, oh yeah, we have these complementary, items that we can use to make our stay a bit better. So going back, so that's how it was before. The third picture, that was how it was before. And when I did it, obviously I spoke to my manager at the time, and she was so impressed with that. So she thinks it's a phenomenal, idea. So she then brought me to the managerial meeting, which, I am a nursing assistant, and, I'm like, how could I say this, you know? So that's how it started. And they're all impressed with the idea. So that's how, you know, it was developed until the trust decided to trademark it. So how could a tray be used? Of course, there is some earplugs that are readily for the patient to use when they arrive, and being information is enclosed in there, so they know that they can use it in the night to have a better sleep. And also, if they have good night's sleep, that means it helps them faster rehabilitation and also a quicker recovery, which means it's shorter stay or reduced length of stay in the hospital. So it's not only benefits to the patient, it's also benefits to the trusts, because it saves, you know, it saves the money. And also, I included hand wipes because I believe the hand hygiene is very important to the patient. And being after the surgery, they can't go to the toilet and wash their hands. That's why the hand wipes is there ready for them to use. And of course, if you maintain the hand hygiene, that means you are preventing from catching possible infection during the stay in the hospital. And also, we are considering at the moment to add an eye mask, which also help them to rest. If there is, sometimes you can't help it in the night, there is a light because nurses will go, doing the drips and, doing some observations, which, at the moment we're considering that. And the other thing is when the patient comes to the hospital, seeing this tray, they think they're more welcome because this is very professionally made. And so that makes them more, settled. I know when you come to the hospital, you think, oh, I'm so anxious, what's going on, But with this, at least, they think they really care, okay? I think, yeah. So after that, we trialed it for a month, and before, as I said, it was 87% of complaint about the noise at night, and obviously it works very well because after a month of trial, we have a survey again, and it came up 15%, which is a massive, difference before and after the launch of this tray, and of course, as I said earlier, it helps the trust also for saving the cost of patient stay and also with the patient. And also, we ask feedback from the patients as well, and it is really, really positive feedback. And we have some few feedback from the patients, which, you can read. And that's how it's developed. Thank you very much. Some more. We only get few feedback from our patients. And that was it, really. Thank you very much for listening. I'm really grateful to stand here in front of you.